after when I do it then.
Okay.
Okay, well, thank you everyone for joining us today and making time for us for Clark Lindsay's new expert informed virtual series on ageism, everyday ageism. In this webinar series, we take a look at the practical impacts of aging in our world. My name is Sarah Hawkins, and I am the Marketing and Community Outreach Specialist at Clark Lindsay in Southwest Urbana. I see many Clark Lindsay residents with us on this Zoom call. Hello, everyone. Also, anyone is welcome to join this webinar virtually. So if you enjoyed today's session, please join us for our future webinars and invite your friends to join us as well. We kicked off the series in September when Dr. Shannon Mejia from the University of Illinois presented about ageism as a stereotype. Last month, Teresa Jones with AARP Illinois talked about ageism in the workplace. And to those who joined us last month, please raise your hand. I'd like to see how many people were there last month. I think I recognize some of the names here. Just like we did then, we're going to have Q&A after the discussion. Feel free to type your questions in the chat box whenever anything crosses your mind. We'll save those questions for the end. So without further ado, allow me to introduce today's speaker, Dr. Allura Lothary, Postdoctoral Research Associate in the Department of Kinesiology and Community Health at the University of Illinois, Urbana-Champaign. Dr. Lothary, we are delighted you are here as our speaker today. Thank you for being here.
Thank you so much for having me. This is my first webinar, so thank you so much for the opportunity to talk to you all today. So I'm going to be talking about ageism in healthcare. Okay, so first, just a really quick about me to give some context to why I'm talking about this. So I am originally from the Midwest, Wisconsin, and I went to Luther College, which is in the northeast corner in Decorah, Iowa. And there I studied psychology and anthropology, and I had a lot of experiences that really kind of paved the way for the research that I do today. So I interned in a senior services home, specifically in the memory care unit, working with older adults with dementia and kind of helping facilitate their daily activities. And I also have some background in music and memory programs. So making playlists for individuals with Alzheimer's, and those experiences were really positive for me. And so it really kind of paved the way for me to go to graduate school and study older adults and things like that further. So I went to North Carolina State and I just finished my PhD in September in lifespan developmental psychology, where my research was mainly on aging attitudes and views about aging and how they're related to health and daily activity engagement. So then I moved just at the end of September to Urbana, and now I am a postdoc at the Human Factors and Aging Lab, which is in the College of Applied Health Sciences, working with Wendy Rogers. And so a lot of my questions now in the research field are, now that we know about all of these issues in terms of how people feel about their aging and how it impacts their health and their activity engagement, how can we do something about it? So Wendy Rogers is a huge researcher in the aging field. She's wonderful, and she does a lot of work on technology-based health interventions. So really trying to focus on what can we do about it? So that's kind of going to be where my realm of talk is today. So just giving a kind of short outline of what we're going to talk about. First, I wanted to give some context into what ageism is, in case you haven't been to one of the other talks, and just kind of bringing a broader picture of what this talk will encompass. Then specifically talking about how ageism directly impacts health. And then I want to spend a bit of time on the intersection between ageism, healthcare, and technology, because that's where my kind of current research is the technology health intersection. And then lastly, I really want to talk about, well, what can we do about it, and kind of strategies or current states of the literature in terms of what we can do about ageism and how we can help fix these issues. And so I also really want to open it up for discussion at the end. So if you have anything that you want to talk about with regards to your experiences of ageism, your experiences with the healthcare system, like keep those in mind, and we will definitely talk about them at the end. Okay. So starting off, what is ageism? And just a basic definition is ageism is stereotyping, prejudice, or discrimination based upon someone's age. And this can be at any end of the spectrum. So it could be younger stereotypes you have about younger adults or older adults, but overwhelmingly, we see that people have negative stereotypes about older adults. So this was an interesting graphic that I found from a recent study that showed that 82% of adults age 80 or 50 to 80 experience everyday ageism in their day-to-day lives. So every day someone experiences some kind of ageism. And this could be exposure to ageist messages, which is kind of the overwhelming picture. So we see things like advertisements, things in the media, news articles, things like that. That would be ageist messages. And then ageism in interpersonal interactions are maybe you hear stereotype or kind of an ageist joke with someone you know, or family or friends, or just experiences one-on-one. And then internalized ageism is something that I'll touch on a little bit, but is more about the experiences that you have had that shape your own opinions and perceptions of the aging process. So maybe you have a stereotype about older adults yourself, and that's kind of an internalized experience. So how ageism impacts health, I wanted to pull a quote from a very prominent aging stereotype researcher, Rebecca Levy, because I thought it really demonstrated how ageism begins to permeate through everywhere. So the quote is, age stereotypes are often internalized at a young age, long before they're even relevant to people. So we might not realize that we're taking in and internalizing age stereotypes at a very young age, and these are going to continue to grow and build until we're an older adult as well, and then they become kind of self-relevant. So ageism starts to impact people very young and continues to be relevant throughout your whole life. And this was an interesting chart that I found from a systematic review just from this year and how ageism directly impacts health. I'm gonna wait on the first, the biggest one, which is the health services, and that's kind of the bulk of this talk today. But it's important to note too that ageism impacts health directly as well. So this includes mental health, physical health, cognitive impairment, and can also include kind of more broader topics like social relationships and quality of life. So all of these areas, it's kind of just permeating through. And then the biggest one on this chart you can see is denied access to health services and treatments. And that's kind of why we need to pay attention to ageism and healthcare, because overwhelmingly that's what we see to be the case and to be the area where ageism makes the most impact. And that denial of health services and treatment then kind of flows further into the different types of illnesses and things like that. So these are all kind of related, but I just thought it was a good graph to show it's kind of everywhere in health. And then kind of bringing it down by level is more scientific, but just kind of understanding how these happen on a daily level or on an interactive level. So when you're an individual, you have your own views and experiences about aging, and that's going to be composed of some stereotypes, but some positive and negative, and just kind of all culminate to reflect how you feel about aging. But that's not the only information you get about aging stereotypes. So on the interpersonal level, you could have your friends, family, even a primary care doctor, someone you're interacting with, and their perceptions about aging are going to be influencing yours. So they might express different stereotypes or different ideas to you, and those are going to bounce off each other and really influence how you feel about aging as well. And this even gets bigger, such that policymakers or healthcare providers might be making decisions based upon aging stereotypes or not having correct information about what normal aging is. And so they might be making decisions about the types of care they provide for older adults that are not necessarily based in the data, but are based in stereotype. And at the societal level, Shannon Mejia's talked a lot about this area, so I would highly recommend going to check her talk out. But the cultural level, America is very youth-centered. So on the cultural level, we have a lot of beliefs about aging, and these might differ across cultures, but they also influence and permeate all of these levels. So these are all kind of interactive. So this kind of really demonstrates that you really can't get away from the aging stereotypes or the ageism because it's at every level. And so this is how it really kind of ultimately affects your health because you're getting all these different experiences that maybe you don't even realize or are unaware of. Now, taking it more to the positive side of things, so there is a lot of benefits to having more positive self-perceptions of aging. So believing that older adults can change and grow, and that there's a lot of differences between older adults, and it's not just aging that is causing negative outcomes. So when you have more positive views about aging, the research has shown you tend to live longer, have significantly better memory and balance, and then also experience sustained or boost your mental health. So it's really positive to have more positive self-perceptions of aging. Now, what I want to spend some time talking about is the intersection between ageism, healthcare, and technology. So all of these things are kind of interrelated because ageism, like I said, kind of sprinkles over both of them. But I wanted to break it down by looking at ageism and healthcare, ageism and technology, and then all three together. So in the healthcare setting, ageism can impact patients through a lot of different means, but some major ways that have been shown have been things like providing incorrect care. So some examples of this would be healthcare professionals seeing a patient who is an older adult and maybe they're expressing fatigue or shifts in their mood or things like that. And instead of kind of taking it based on symptoms or from the individual's perspective, they might say, oh, you're getting older, so you're getting grumpier. It's going to result in mood changes, having these stereotypes about what it means to be an older adult. And so that may also result in providing incorrect care such that you don't treat depression if that is what the actual symptoms are indicating, and instead just kind of avoid that type of care. And it can also be misattributing symptoms to normative aging, kind of like the example I just mentioned. So doctors or other healthcare professionals might just assume something is aging when it actually is not. And so this kind of results in making blanket assumptions about individuals due to their age, regardless of their health. So not paying attention to the individual themselves and their health background and their current and past symptoms, instead just saying, oh, they're an older adult, so here's what I know about them, and making blanket assumptions. And another area which is really important to think about too is that if older adults are experiencing ageism in the healthcare setting, this is really going to impact their willingness or desire to seek care in the future. So if you go into the doctor and you're constantly being told like, oh, it's because you're getting older or it's just a normal symptom of aging, but you yourself know it's not correct, you might continue to just avoid going to the doctor or not engage in behaviors that would help your health, like monitoring your own symptoms or things like that, because you feel defeated or just feel like you're not getting anywhere. So it's really impactful in terms of allowing patients to seek future care. And I thought this was a nice table too, outlining some examples of ages.
This morning. You what? Yeah, I fell on the toilet because I thought my 3-year-old forgot to put the toilet seat down. No, it was my husband. Yeah, that was a very awakening this morning. I was like, whoa, I'm awake now. Wasn't so quite awake yet.
Sorry, I just think someone's unmuted. Okay, so we'll keep going. But I thought this was a really nice outline of examples of ageism in healthcare. So what's important to think about too is that healthcare doesn't just mean your primary care physician or your doctor. This includes like every experience that you have. So this could be from the staff members, nurses, really anyone you interact with. And examples of things that you might experience that would be ageist would be things like treating things that are natural effects of aging as a disease or vice versa, sharing and laughing at ageist jokes. What is the majority of experiences of ageism in healthcare are implicit, which makes it complicated. So they're not necessarily, people aren't necessarily aware that they're ageist, but staff members might have ageist thoughts, feelings, and behaviors towards elderly patients, and this is really going to influence the way that they treat and talk to and engage with older adults because of the stereotypes that they hold. And another one that I haven't yet talked about that's really important is that older adults are often excluded from clinical trials. So then it doesn't really help us to understand and create a larger amount of knowledge surrounding how to treat older adults or conditions for people who are older adults, especially if they have multiple chronic conditions, which we might see. So these are all just different ways that ageism might be impacting healthcare experiences. Now, kind of stepping over to ageism and technology, there's a lot of stereotypes in this realm too, as far as older adults' willingness and ability to use the internet or use other types of technology. But a lot of the recent research has shown that older adults are willing and excited to use technology. So those who do already use the internet use it several times a day. Almost 3/4 of them use it at least once to several times a day. And adults over 50, most have a laptop or desktop nowadays, so 92%, 70% use a smartphone and things like that. So it's just not true that older adults are uninterested in using technology or unable to. They are continuing to grow and build and be excited about using different types of technology. And where this intersects with the healthcare field is that there's a lot of health management technology coming out. So I had an undergraduate research assistant in my lab go ahead and look at the current healthcare technology models and different types of technologies that are out right now. And so I specifically wanted them to look and see, well, how are they advertising this material? So who are they targeting? What's the audience that they want to get to help people manage their own health? And so as you can see from all the pictures on the screen here, overwhelmingly the target audience for the healthcare technologies seems to be younger to middle-aged adults. We didn't really find any advertising materials showing older adults managing their own health and using technology. And it's not just like a specific type of healthcare technology. This is a lot of different ones. So there's monitoring your temperature, your blood pressure, your water intake, sleeping, air quality, your digestive health. So all these different types of healthcare technologies are out there and available, but because of the stereotypes regarding health and technology, they may not be targeted towards older adults. So both older adults won't know that they're there to use them and that they are for them, but also if the doctor was going to make recommendations in terms of things that they could use to help manage their own health, they probably wouldn't think that these technologies are for them as well. So I thought that was a really important thing to highlight and understand, is that there's lots of things available and stereotypes might be limiting people's ability and knowledge about what's accessible and how they could use this information to benefit them. So in our own lab, the Human Factors and Aging Lab, we have done some research about specifically how to create technologies that might benefit older adults, particularly in the health realm. So the things that I started working on, and Clark Lindsey Village has definitely been a partner in a lot of these projects, so they might sound familiar to you. But we have worked on apps and online platforms. So the one-click system is a chat, kind of like Zoom, but a little bit more user-friendly, and it's targeting social engagement. So especially now when we can't go out and see everybody, this is a really important technology that we're trying to build specifically for older adults with and without cognitive impairment, so that they can remain socially engaged. But we've worked on a lot of other different types of apps and online platforms as well that are specifically targeting older adults so that we can understand the unique challenges that population has, but also so that we can create something that we can further market in the future to kind of overcome some of those issues that I just showed on the last slide, where all these different technologies are available, but they're not targeted towards older adults. And so you might not know they're there, or you might not think they're for you. So we also have done things like improving hypertension medication adherence using an app, personal reminder systems. There's some really cool work in the lab that I'm not personally involved in, but there's some great people working on robotics. So understanding older adults' preferences and needs for assistive robots. And then something that we do that's really important, I think, too, is needs assessment. So really interviewing and understanding the challenges, concerns, and needs of older adults as a population to help make products that make a difference. So are there ways that we can bridge that gap between the ageism of society and healthcare technologies? Okay, so I also just kind of wanted to bring in context the pandemic, because I think you might have seen a lot of articles that are talking about how ageism is making the pandemic worse and how it's really kind of brought to light the ageist stereotypes and culture that we might have here in the US. And the way that I have tried to think about and understand this is that a lot of, especially at the beginning of the pandemic, a lot of the information that was coming out was kind of making overgeneralizations about older adults and older people in terms of their risk and what to expect. And a lot of the research, especially at the beginning, was focused on treatment of kids and younger adults to middle-aged adults. And so there wasn't really a protocol for understanding older adults, which might not be the fault of anyone, of course, because it's just healthcare professionals reacting, but there's very much a lack of healthcare training in terms of focusing on older adults' needs and differences, because as a population, older adults are incredibly variable, so there's lots of differences between all older people, and so really understanding their health as the context instead of just age itself has been really important. And so I think things are starting to change and people are starting to make recommendations that are about older adults. But I think especially at the beginning, we saw a huge uprising of ageist stereotypes and opinions about older adults that just weren't true. And I think the pandemic really elevated and brought those to the forefront. So if anyone has thoughts about that later on, like definitely feel free to share. Okay, so kind of stepping away from the problem, now what can we do about it? And I'm going to cover a couple of different topics that have been looked at in the literature. So this includes education, intergenerational contact, and then using a combined method. So first off is education. So this is pretty self-explanatory, but in general, educating people about normal aging processes and challenging inaccurate stereotypes can be beneficial across the board. So a lot of the current literature has been focused on educating like undergraduates and younger adults, but this works for older adults as well because they might have stereotypes that they've held for a long time and just weren't aware of. And this could also be very important to think about in the context of healthcare. So a lot of healthcare professionals might not get specific age-related education or information, and so they might not be aware of the inaccurate stereotypes they're holding. And what the research also suggests is that using multiple methods to teach this information is really the best way to get that out. So using lecture, videos, discussion groups, really like working with and playing with it in lots of different settings because these are pervasive. So we generally don't realize that we have all these aging stereotypes that we've created and held and experienced throughout our lifespan. And another really interesting way to approach this problem is to increase intergenerational contact. So some of the research has started working on interventions that connect people of all ages to understand and reduce the perceived differences. So this is really a way to actively challenge prejudices or stereotypes. And then the really good outcome of this is that you can have shared activities or interests that would facilitate friendship. So again, this has been mostly in the population of undergraduate researchers or undergraduate students with older adults, but this could work in lots of different ways. I've seen a really cool model where nursing homes have incorporated daycare facilities for young children, and they have intergenerational contact regularly. Obviously, that's not available in the current context, but these things have been shown to really reduce aging stereotypes because you're thinking about people that you actually know instead of just the stereotype. And what's shown overall to be the best method is combining the two. So using education to help change perception. So what is normal aging and what's a stereotype and challenging those, but also having multi-generational activities and engagement so that you can continue reducing the ageist stereotypes. In the healthcare context, there's a lot of things we can do. So again, more training and education for healthcare professionals. So a lot of healthcare professionals don't have even like a semester's worth of courses on geriatrics or even older adults, normal aging processes. So unless they're an aging specialist, a lot don't have that kind of background. And so I think there's a lot of opportunity to increase the training and education about older adults. Another area would be greater inclusion of older adults in clinical trials. This says older Americans, but in general, understanding the unique needs of older adults so that we can provide better treatment or preventative measures. So by including them in clinical trials, that's kind of a step forward in that area. Again, utilization of appropriate screening and preventative measures for older Americans. So a lot of the standard procedure in terms of screening and prevention for older adults is based on a stereotypic model. So not seeing the person as an individual can really hinder the type of screening or preventative behaviors you suggest for your patient. So really understanding the issues here could help people get the appropriate training, but also get the appropriate treatment that they might need. And then the last one is more about the older patients. So empowerment and education of older patients. So that's taking it instead of the side from the healthcare professional or provider, giving older adults agency to kind of identify and not accept ageism. So giving them information about what is an aging stereotype versus what's normal aging, and helping them to work with their healthcare provider so that they don't have to constantly be combating this. And so I think that some of the ways that this has been starting to work is by having specific people be trained in different healthcare settings as the person point of contact for experiences of ageism. So if that's an availability, that's an option too, but also just outreaching to older adults so that they can advocate for themselves. Okay, let's see if I can share this.
Being age-friendly as a health system means that everybody that is involved in the healthcare of older adults, from the person who cleans the room, that greets you at the desk, your nurses, your doctors, therapists, everybody understands what's important to you as an individual, understands that as we get older, we accumulate more conditions, that we value different things, that what matters most to me may be a little different than you, that we have different cultural and social things that really matter to us and should be included in our care and our decision making, and the fact that it's not just about treating the diseases. I think one of the big pieces that everybody that's part of age friendly health system should understand that healthcare is not treating diseases. It is treating patients who may have diseases, but have a lot of other things happening as well. You have to understand that with aging, people do accumulate more conditions, so they become more complex. They vary in what matters most to them. They may have some sensory, vision and hearing difficulties that need to be recognized and adjusted for, maybe having mobility issues, so need more help with moving around, and most important, recognizing that older individuals vary in what matters most to them. Some of them want their blood pressure as tight as it can be, their glucose perfect, spot on. Other ones are more concerned with feeling comfortable and not burdened by their health care from day to day. So it's really recognizing that each individual has different needs and interests and responding to those.
Okay, so that was a clip from, there's an International Healthcare Institute that is focused specifically on different issues in healthcare. And so the issue that they were talking about in that video is obviously ageism and treating older adults specifically. And so I think there are a lot of working models and different pieces and organizations that are working on this and are thinking about it. But I thought that was a good video to show that there are actionable steps that people can take, and that treating people as individuals instead of based on their age or disease is really the important model going forward. Then kind of thinking about us as individuals who might not be healthcare providers, how can we challenge ageism in our everyday lives? And so one way would be just to create a more positive environment. So kind of interacting with people in a positive way, but also being open to new experiences and challenging those negative stereotypes as they come about. So if someone says something that's a negative aging stereotype, to actively challenge why they think of that way, or kind of maybe just don't just shut it down and don't even engage with it, to kind of just overall create more positive environment. Staying physically and mentally active is just helpful for everyone and can really help fight your own feelings about ageism. So some of my dissertation research was on how changes in physical, mental, and cognitive health relate to our changes in views of aging. And so if you experience declines in physical and mental health, this kind of informs how you feel about the aging process. So staying physically and mentally active is really important for helping continue to grow. And then challenging stereotypes and ageist self-talk is really important, and fostering positive relationships with people of all ages are all different, like small actionable steps that we can take to challenge ageism, regardless of how old we are. This is just, I'm not going to show this video, I think, but AARP has a Disrupt Aging program now. So if you're a college professor, you can incorporate this type of curriculum in your lectures. If you're just an individual person, you can also look at disrupting aging to really understand what aging stereotypes are and the different ways they impact. But I thought this was really good material too. Okay, so that is all I have, and I just want to open it for discussion. I'm going to stop sharing. So thank you so much.
Okay, any questions, anyone?
I have a question not related so much to the presentation, but thank you, Allura. That was very good. What's the status of the house?
The Clark Lindsay Village House, or?
The one on campus, the technology house.
Oh, I'm trying to think. I'm not directly related to that because I don't do the robotics side of things. But I want to say it was mostly ready to go before at the beginning of the pandemic.
Right.
And now we just have been using it as like an office space because we can only have like one person at a time. But I think next summer for sure it'll be open and available. I know that there's a lot of different spaces that were like getting finalized right as the pandemic hit. So
Sarah, I'll have a question for you.
Oh, okay.
What's the status now of our interns at Clark Lindsay? Obviously we've been impacted.
Yeah, so, well, obviously we still have them, just at, we just don't have as many because those who are doing their internship are doing them remotely. And so not every preceptor is able to do remote internships just because of, what the intern would be doing at home. I know that I just got an email asking me if I wanted another one. I have one now. And so we will continue. We want to continue as we can, we definitely don't want to lose that because that partner, that internship program is very important to us. And so it's continuing. It's just going to look quite a bit different than it has. And I don't know for how long. So me and Karen have shared one this semester just because, for me, like, I do a lot of outreach, community outreach, and it's obviously we'd love to do activities in the community and we're not able to do that. And so that's actually kind of what this, webinar series has become, is more remote outreach. If we can, we'll do that, but there's not as much work on that end for my intern because, we're not checking people in and giving name tags and all those things. So yeah, we're doing our best with what we can do. We also don't want to bore people with Zooms. People, I feel like people sometimes feel like they're zoomed out. Like I can't do another Zoom meeting, or I don't want to do another Zoom meeting. So we want to be careful with that too. But I mean, obviously I think that doing the Zoom is, like you said, Kathleen, is better than nothing in my opinion. So I think we'll just continue to do what's safe for everyone. So
Allura, I really enjoyed your presentation, and I was hoping that you could tell us a little bit more about when you worked in, was it a retirement community that you worked in, and how did working there impact you where you wanted to do research and study how to make things better for all of us?
Sure. Yeah. So I did a month-long internship because Luther College is like a liberal arts college. So we had like a January term that was like a month where you're supposed to go off and do some other things. So I worked in the memory care unit specifically. I didn't have a lot of roles because I wasn't a nurse or anything, but I mostly just spent time with the residents trying to hang out with them, get a sense of their daily activities, and then encourage them to participate in different things, so puzzles and games and other things. And what my ultimate project was understanding how death impacted the residents of the memory care facility. So because they have memory challenges, I wasn't sure kind of how death of another resident in that small community environment, it was like 20 people, how that ultimately affected them, because they might not saliently remember the person, but what I kind of figured out along the way was that the emotional impact really carried through the whole staff and everyone in the system or everyone in that community. So that really got me kind of interested in those kind of dynamics too. So I'm really interested in caregiver outcomes as well, more on the informal side, so like spousal caregivers or family and friend caregivers. But it just kind of solidified to me that there was a lot more that we could do to improve quality of life for older adults, especially with the memory care side of things. But also just that there's such a tight knit community there. So it just, yeah, it was a really good experience for me.
Thank you for sharing that.
Yeah.
Well, I guess if nobody has any other questions, I think we'll conclude this today and join us in January. As we mentioned, we're going to take December off. It's a crazy kind of month for a lot of people. So taking December off, and then we'll be back at it in January of 2021 with Dr. Shannon Mejia from the U of I. She's going to return and talk about ageism and technology, where
Nice.
you spoke a little bit on. And enjoy the rest of your day and have a safe holiday season. Thank you so very much.
Thank you.
Thanks. Came in late.